The Crohn's and Colitis Foundation of Canada is pleased to provide the new educational materials on this video. Whether you have Crohn's disease or ulcerative colitis, or have a friend or family member who does, we hope that our video series will help demystify these conditions. In this presentation, we explore the basic facts about medications used to treat the diseases. Inflammatory bowel disease, or IBD, describes two similar yet distinct conditions, Crohn's disease and ulcerative colitis. They are chronic inflammatory disorders which can strike anyone, regardless of age, race, or gender. There is no known cause or cure for these painful and unpredictable diseases, but the CCFC is working hard to change that. We are a national volunteer-driven foundation which raises funds for IBD research. Our mission is simple. We want to find a cure for IBD. Each year, we invest millions of dollars in medical research initiatives to help us reach that goal. Educating people about IBD is also a major part of our work. Canadian gastroenterologists, researchers, and other health professionals are key partners in our research and education efforts.
Currently, there is no known cause for inflammatory bowel disease, but the prevalent theory is that the patient is probably reacting to something in their environment in an inappropriate way. Their immune response is seeing something that someone else won't react to. And the reason for that is their genetic makeup. So it's the interaction between that patient's genetic makeup, something in the environment, and the abnormal immune response to that environmental agent. A bacteria could surely be the cause of inflammatory bowel disease, but the research to date has really not identified a specific infectious agent, be it a bacteria or a virus, as the underlying cause. It may well be that it's the normal bacteria in your intestine that leads to an abnormal immune reaction that leads to inflammatory bowel disease.
There are many drugs that can be used to treat ulcerative colitis and Crohn's disease. Among the oldest medications is sulfasalazine. Sulfasalazine is an anti-inflammatory that reduces inflammation and as a result reduces many of the symptoms of ulcerative colitis and Crohn's disease, such as the diarrhea that patients experience. 5-ASA drugs are among the most common drugs used for inflammatory bowel disease, in particular ulcerative colitis. They seem to work better for ulcerative colitis than for Crohn's disease, and they're very good because they can be used to treat active inflammation as well as maintain remission once the patient's symptoms are resolved. Steroids have been around for a long time and are among the most effective drugs for the treatment of ulcerative colitis and Crohn's disease. They're nice because they're very potent and one can use them to treat patients with moderate or severe attacks, but they do have many side effects which limit their use and make them unattractive to some individuals. The immunosuppressant drugs are used primarily for patients who have an aggressive form of inflammatory bowel disease. They're often used to try and get patients off of steroids and maintain remission over a long period of time. These drugs, such as azathioprine or methotrexate, tend to suppress the body's immune system and as a result reduce the inflammation in the bowel. Antibiotics can certainly be effective for the treatment of inflammatory bowel disease, in particular Crohn's disease, and in particular for certain complications of Crohn's disease such as fistula or abscesses. A lot of excitement has been generated around antibiotics and the potential for possible cure, particularly Crohn's disease. And that's related to a theory that a bacteria that's related to tuberculosis bacteria may be causative for Crohn's disease, and that by treating this bacteria with antibiotics, one might be able to cure Crohn's disease. However, there have been numerous clinical studies that have shown that this is not the case.
To date, we do not have a cure for inflammatory bowel disease. The treatments that we have can control the symptoms very well and induce what we call remission, which is essentially a symptom-free period. To say that the patients have been cured of their disease, we do not have treatments that will actually make the disease go away forever.
There's no medication that can absolutely 100% prevent relapse. However, medications will reduce the risk of relapse, in many cases by 50 to 80%. So it's always better to be on a medication that is effective for preventing relapse. In many cases as well, being on a maintenance drug will reduce the severity of a relapse. Many of the complications or side effects of inflammatory bowel disease can be minimized by careful follow-up by a physician and monitoring. Sometimes this requires periodic blood tests, sometimes it requires annual examinations, even when one is feeling well. And sometimes this may require special dietary interventions. For example, with lactase deficiency or lactose intolerance, it's important to maintain an adequate intake of calcium in the diet or through supplementation. Patients don't always have to take vitamin supplements when they have inflammatory bowel disease. Probably the most important thing is to take adequate numbers of calories in a well-balanced diet encompassing all of the food groups as outlined in Canada's food guide. However, in some instances, specific vitamin supplementation is required. Vitamin B12 is one of the more common vitamins that requires supplementation, particularly in people who have Crohn's disease, and particularly those who've had some of their small bowel resected or taken out surgically.
I believe there will be a cure, but it's going to take a considerable effort. It's going to require new, young scientists, clinicians. It's going to require harnessing new technologies that are being developed. Putting that together, I think we will see a cure, and I see the CCFC as one of the main supporters of making that happen.
Tens of thousands of volunteers, members, donors, and sponsors across Canada are with us in our mission to find a cure. We hope you will become part of the CCFC team today. By volunteering your time, participating in our fundraising events, or making a donation, you will be contributing to research that is helping to find a cure. For more information, contact the CCFC at 1-800-387-1479, 416-929-0364 in Toronto and area, or visit our website at www.ccfc.ca. Help us find a cure.